it's me again, Jess from Opticare. As part of our Like No One Else video campaign series, today we'll be focusing on Prism Management, which is really becoming increasingly relevant in behavioural optometry and with binocular vision cases. For these patients, Prism can help manage symptoms like double vision, an eye strain, headaches, visual discomfort, and difficulty with near tasks. And that's why Prism is a really important prescribing consideration, particularly when the visual system is already under increased demand. So Prism works by altering the direction of light entering the eye, which creates a controlled shift or displacement in the image. And this helps reduce the effort required for binocular alignment, and it can support patients with convergence difficulties and also with other binocular vision conditions. So traditionally, practices have had limited control over where Prism is positioned within the progressive lens. For many, many years, Prism has been calculated at the geometric optical center, or the Prism reference point, PRP. In a progressive lens, this point is typically 4 millimeters below the distance optical center within the progressive corridor. Now, this means that the prism is not positioned where the patient actually uses the lens for primary distance vision. And this disconnect can contribute to visual discomfort, non-adaptation, patient dissatisfaction, and also potential remakes. So, to address this, Opticare has developed Prism Management. This gives practices greater control over where Prism is positioned within the progressive lens. So rather than being limited to the traditional Prism reference point only, practices can now choose to position Prism either at the geometric optical center or at the distance optical center. For patients who primarily need Prism support for distance vision, positioning the Prism at the distance optical center can be a way more clinically relevant choice. After all, that's where the patient actually needs the Prism to perform. And by doing this, you can make a meaningful difference to your patient's visual clarity, their comfort, adaptation, and their overall satisfaction. Because as you know, Prism jobs are high risk, and they always require careful consideration, collaboration, and the right progressive lens design. In Prism cases, where and how the Prism is applied can be just as important as the prescription itself. So, if your practice is managing more Prism, if you specialize in binocular vision, or if you welcome more behavioural optometry cases and you'd like to learn more about Prism management, please get in touch with us. I'd be happy to discuss how it can support your patients, your practice, and help you deliver care like no one else.